Hi everybody, welcome to my talk today, how to become a charge nurse, nursing sister or senior nurse. Different terms are used in the UK, and this is part of the nursing career series. I have a video on nurse educator roles, nurse researcher roles and specialist nurse and advanced nurse practitioner roles. So I hope you find this series helpful. Do check out the videos on my YouTube channel. It's free to subscribe. Support and career development for nurses, and I hope you find it helpful. So this talk is aimed at early career nurses or student nurses thinking about a clinical leadership pathway, such as a charge nurse, nursing sister or senior nurse. And I have been a nursing sister on a neurology unit for many years, and I'm on interview panels, and I'm currently career advise nurses thinking of going into these types of roles. So I'm often asked, how can I become a charge nurse or a nursing sister or a senior nurse? So I'll give you lots of tips in this talk. Oops. So first thing to say is these type of senior leadership roles are across a range of fields and settings, and there's different titles, and so they cover mental health, nursing, adult nursing, child health and learning disability, and roles in the community, primary care, GP setting, outpatients, intensive care units, acute care and rehabilitation, and also in digital health, clinical governance and health education and health promotion, and with different job titles, so a real variety. When looking at the overall key responsibilities in leadership roles, there will be leadership and operational responsibility, usually for a team and to deliver a service, depending on the role, effective budgeting of resources and safe staffing, promoting quality and safety adherence to local and national legislation, policies and standards. There may be certain targets aligned to the service delivery, and it should all be underpinned by evidence-based practice. Promoting effective collaborative team working is a key responsibility in the role. Lots of people management and support and well-being for staff. Being responsible for supporting, professionally developing staff in an area, and assurance of compliance with training. So these are some key responsibilities, but as I said, it's dependent on the role. So 4 ways to support your progression in relation to these roles. So I would say increasing your insight of the role, and I'll give you some tips. Developing your leadership skills and completing academic courses aligned to the role, and preparing rigorously for applications and interview. One of the best ways to increase your insights and knowledge of a role is to review the job description and personal specification for the requirements relating to professional experience and for academic qualifications. To be shortlisted for these roles, there will be certain a certain parameter set for experience and knowledge and skills, and it varies across employers. Another way to increase your insights is to book informal visits with the charge nurse and the leading recruiting officer for that role. If you're an early career nurse or a student nurse, ask to have some shadowing experience and some time with people in these roles. And it's really interesting to see, and I often get students or early career nurses come back to me and say, I really didn't realise that's what a nursing sister or charge nurse did. And it can really open your eyes as to the role, as to whether it's something you would aspire to or whether it's not for you. So connecting with senior nurses in the field and setting that you're interested in, and also finding a career coach or advisor or clinical supervisor to help you start aligning your professional experience and academic qualifications towards these leadership roles. So developing your leadership skills is important, and you can start by supporting local line manager, matron and the leadership team in your area, and try and link into local project work. contributing to policy development at local, national level through professional forums. We have the RCN Leadership Forum, for example, or shared governance groups. Sharing, disseminating and publishing your work will influence future practice and also will strengthen future personal statements. And I have a YouTube video out with some helpful tips on how you can influence nursing practice. Another way to develop your leadership skills is to collaborate with or lead a quality improvement or research project. And I have a YouTube video on quality improvement and service improvement projects for nurses, explaining how they work and some example projects. Thirdly, completing training and academic courses aligned to the leadership role that you're aspiring to. And many employers have in-house leadership study days, conferences and training days. There's also the NHS Leadership Academy and national conferences and leadership talks that are often advertised. The NHS Leadership Academy has programmes on their website such as the Edward Jenner programme, which is aimed at new leaders who wish to gain a fresh perspective on the delivery of services and the impact on patient experiences. Mary Seacole programme is aimed at individuals who are looking to move into their first leadership role or are new to leadership. And on completion, they're awarded the NHS Leadership Academy Award in Healthcare Leadership. There's the Rosalind Franklin and Elizabeth Garrett Anderson programme aimed at mid-level sort of leaders, and Nye Bevan as well programme. So go onto the websites and have a look at what's available. And then when you're looking at your job descriptions and your personal specifications, you may see some of these sort of leadership type courses and qualifications required for roles. It may say working towards a leadership course, or it may be an essential qualification. So these requirements are dependent on the role, and some leadership posts are requesting master's level leadership programs. So do check out prior to application. So finally, rigorously prepare for applications and interviews, because these posts are competitive. There's usually only one charge nurse or one nursing sister in an area. And it's very important to understand the key terms that are on that job description and prior to interview, such as quality improvement, clinical governance, risk management, clinical effectiveness, change management. And what do these terms mean? How are quality standards measured in your area? What are the national standards? And there's different leadership styles you can use. And in my book, How to Prepare for Interviews and Develop Your Career, I've got some really clear tables with definitions of key terms that you might be asked. So it's really helpful for preparing for interviews. So good luck when you do apply for these roles. And I have helpful videos on my YouTube channel that are free. It's free to subscribe, and I've got helpful videos of how to prepare for interviews for these roles. Do ask any questions in YouTube, and you can DM me on Twitter or on my website or Instagram. So I hope you found this overview helpful.